Hello friends, today in this video we will going to discuss about breastfeeding. Basically, while discussing breastfeeding we will going to ask some questions and thereby try to give proper answer to those questions. First question regarding breastfeeding is, what are the different type of breastfeeding? Well, there are some confusion regarding this, but according to the WHO, there are three type of breastfeeding. Number one is exclusive breastfeeding. Well, exclusive breastfeeding means that baby will only be fed by breast milk. No other food or drink, not even water, is given to the baby. Medicine, vitamin, mineral drops, however, may be permitted according to the physician advice. So that is the exclusive breastfeeding. Next is the predominant breastfeeding. In predominant breastfeeding, the main source of nutrition is the breast milk, but child is also can receive fluid like water and water-based drinks such as tea or juice or Horlicks. But the main source of calorie is breast milk. And thirdly is the partial breastfeeding. The child in this case receive non-human milk such as different infant feeding formulas and even the cow milk also, and in addition to that baby also receive breast milk. So this is the three types of breastfeeding, and according to the present standard set up by the World Health Organization, exclusive breastfeeding is the feeding of choice up to 6 months of age. And after 6 months, the predominant breastfeeding is being done for next 5 to 6 months, and after that baby is put on partial breastfeeding, and from there on the normal feeding of an adult gradually being done. Next question is it better to feed a baby by a cow milk as being practiced in many parts of developing country over the breast milk? First thing one I should mention here clearly is that there is nothing more better suited for the baby than the breast milk, because breast milk has something that are cannot be synthesized even by the most advanced companies as well. Because why I'm saying so, it will be understand in short. First we are going to compare the breast milk with the cow milk. First is the protein. The human breast milk is found to have 1.1 gram of protein in comparison to cow milk which have 3 gram of protein. Similarly, fat is found to be almost similar to that of cow milk, but the lactose is more in human breast milk than the cow's milk, that is 7 gram, as compared to cow's milk, that is 4.5 gram. And then comes the vitamin K, which is not very much essential, not required in higher amount. So the breast milk have 15 microgram as compared to 60 microgram present in cow milk. And last but not least is the sodium, that is present at a dose of 4.7 milliequivalent per liter in case of human milk as compared to the cow's milk of 2.2 milliequivalent. So what we find is that human milk contain more of lactose and lesser of protein, which is actually the need of the baby. Similarly, one thing I should mention here is that human milk protein is lactalbumin and lactoferrin, which is in comparison to cow's milk have casein. in 80%, and this casein is very much allergic to baby. So the human milk completely is a winner in this case in comparison to the cow milk. Now next in our contention is breast milk versus the formula fed baby. Formula fed, by formula fed we may want to emphasize all the feeding supplement that are being claimed by many multinational company as a substitute to breast milk. Some are telling it is better than breast milk, but one thing I should try to clear here is that there is nothing better than breast milk, and why I am telling, you will understand when I mention the following. First is, what are the, here I am mentioning the thing that are present in breast milk which we will not going to find in the formula fed baby. First is immunoglobulin A. Well, the immunoglobulin A is present in breast milk which are not in the formula fed baby, and the immunoglobulin A, especially the secretory immunoglobulin A, offer protection to the respiratory tract and GI tract. So what we find is that the formula fed baby are much more susceptible to diarrhea and respiratory tract infection as compared to breastfed baby. Next is lactoferrin. Lactoferrin job is immunomodulation, iron chelation, antimicrobial action, and tropic intestinal growth factor. So here also the baby's immunity is far more enhanced by lactoferrin, which is present in breast milk. Next is oligosaccharide. Oligosaccharide, as we all know, prevent the bacterial attachment to the intestine, and hence the baby is lesser susceptible to diarrhea as compared to a formula fed baby. Next that is present is cytokine. As we all know, cytokine is an anti-inflammatory mediator which is also act as an epithelial barrier function. So what we find is that all these factors enhance and give a boost of immunity to a infant feeding by breast milk as compared to a formula fed baby. Next important thing that are present are all the growth factor. Growth factor cannot be supplied by any kind of formula fed baby, which are absolutely essential for a baby to have. And some there are many growth factor, but the three most important growth factor that is to be mentioned here is that epidermal growth factor, which is help in repairing of intestinal cell. Then the transforming growth factor, which is important for the promotion of epithelial cell growth factor and suppress the lymphocyte function. And lastly is the nerve growth factor, which promote the neural growth. And next very important thing that are not present in breastfeed, not present in formula fed supplement are the enzyme. What are those? Number one is platelet activating factor. As the name suggests, it blocks the action of platelet activating factor activation. Next is the glutathione peroxidase, which prevent the lipid peroxidation and hence reduce the generation of free radical. And lastly is the nucleotidases. This enhance the antibody response and the bacterial flora. So clearly we can find that the breast milk is no match, the infant the formula fed are no match for a breast milk because of the presence of all these important factor that are not found in the formula fed baby. Next is the contraindication of breastfeeding. As we have already told that the exclusive breastfeeding are important, but there are some diseases in which mother is better to avoid breastfeed, and they are, first one is HIV, then is tuberculosis, thirdly is herpes simplex virus infection, fourth is varicella zoster virus infection, fifth is cytomegalovirus infection, and sixth is hepatitis B and C infection, and By and large, all the mothers suffering from cancer and undergoing chemotherapy should avoid breastfeeding. Mothers are also advised to prevent or abstain them from alcohol and cigarette during the period of breastfeeding. And lastly, and the very important thing is, what is the correct method of breastfeeding? There are many notions regarding the proper method of breastfeeding, but that one thing I want to mention here is that there is no rocket science behind feeding a baby. It is just simply allow your baby to feed, and only one thing that you have to do is to assist baby in helping him or her to do so. The generally the thing that are being said is that baby's head and body should be in a straight line. Baby's body turned towards the mother and nose opposite to the nipple. Baby's whole body should be well supported, not just at the neck or shoulder, and baby's body touching the mother's abdomen, which is also very important. So this is the correct method of breastfeeding, and this concluded our discussion on the importance of breastfeeding. Hopefully you have been benefited. Thank you.